Hi, today I'm bringing you a very interesting case of headaches. In today's case, I'm talking about a patient that I was following for unrelated questions, but on that day, when he arrived at the clinic, he complained that he had a very strong headache. So I had to solve this before I could continue with the treatment that we were doing before. The techniques that I'm going to share with you today are techniques that I like a lot to solve acute headaches, but they are not my favorite if I'm treating chronic headaches. Meaning, if I'm treating a patient that has repeated headaches and I want to prevent them in the future, this is not the technique I'm going to use. There are better variations, in my opinion, but this is my number one approach when the patient arrives in a crisis and I have to solve it. When treating headaches, as with any kind of pain, if you're using the balance method, one of your main concerns is which channels are affected. And for headaches, typically you have three main types of headache. You have frontal headaches, which are mainly related to stomach. You have lateral headaches, which are typically related to gallbladder or liver. And you have headaches in the back of your head, which typically are related to bladder and kidneys. All of these will require a slight adjustment when treating, but the mechanics of the treatment that I will show you will work on any kind of headache. You just have to adapt to the channels you're using. If you'd like to learn more about the techniques that I talk about in my videos, just check the links below where you can see all the courses I have available. I have courses both in English and in Portuguese. In this case, we were treating a male patient, age 43, and this, as I told you before, is a patient that I was following for completely unrelated questions, but on that day he arrived at the clinic with a very strong headache. He complained that he had a lot of pain, it was hard for him to be in noisy environments, and it was also hard for him to be in very bright rooms, so he was having some phobia to the light also. My first question when treating headaches is to ask the patient, where does it hurt? And in this case, it was a very typical stomach headache, all frontal. So I diagnosed it with the main affected channel being stomach. This was very obviously also a headache caused by excess, not deficiency, because the patient had a very red face. It was very sudden and very strong headache. It was a headache on the stomach channel, which are typically also related to excess. And also from what I knew from the patient, he worked a lot, he had a lot of stress in his life. So it was very clearly a headache caused by an excess problem. In cases like this, my first approach is always to do bloodletting on the ear apex. I did it on both sides and I took a few drops, maybe 8-10 drops of blood from each ear. After doing this technique, the pain went down and the patient described it as the air coming out of a balloon and the pressure leaving his head, but he was still in pain. So I kept on working along the lines of the balance method and Master Tung acupuncture as I usually do. When I'm treating headaches, I like to avoid scalp acupuncture because I think that sometimes it can make it worse to use needles on the head when the patient is having headache problems. There are a couple of points that I really like to use to treat headaches, which are lingu and dabai. Why are these points so good for a case like this? First of all, they are on the large intestine channel, which balances stomach, as we know. They are on an image that is great for the head, which is the hand, and they're close to large intestine 4, which is a classical point to treat headache. All this makes them perfect to treat acute headaches. The question here would be, would I use left side, right side, or both sides? Since, as we know, large intestine only balances stomach through system 1, which is mandatory opposite side. So I asked the patient if there was one side of the head that was more painful, but he said that no, that it was frontal. Both sides are exactly the same. So what I decided to do was to palpate the points on the left and the right side and use the more painful ones. And in that case, the patient said that the right side was more painful, so I needled the right side. After this, the patient said that the pain went down even more, and now it was barely bothering him. I could have stopped here, but I decided to add the guiding needles. So I went for stomach 43. But when I looked at his left foot, I saw there was a very superficial bluish vein on the area of stomach 43 on his left foot. So instead of needling the point, I bled this superficial vein and asked the patient how he was, and he said that the pain was 100% gone. I think this is a very interesting treatment for a couple of reasons. First of all, I know that a lot of people have problems solving headaches in the moment. Maybe you get good results treating chronic headaches or chronic migraines even, but if the patient arrives at the clinic with a lot of pain, I know that sometimes we have trouble solving the crisis in that moment. And this technique is not foolproof, but it's almost foolproof. If you take this approach, in most cases, you will resolve the headache or at least reduce it very, very much. Another important thing for me, it was that the patient didn't come to the clinic because he had a headache. He came to the clinic because we were treating other problems. And if I had to use a lot of needles or spend a lot of time solving this headache, maybe I wouldn't have time to treat the main reason why he comes to the clinic, or I would have to not treat a headache and do the treatment, and the patient would leave the clinic with his headache with a lot of pain. So like this, with 2 needles and bloodletting in 2 places, I was able to solve the problem and still do the treatment that brought the patient to the clinic. So this is a very good tool to have in your toolbox. Again, I will tell you, this is not my main approach to treat chronic headaches. This, in my opinion, is great for acute headaches. If you like this video, don't forget to like and subscribe. It is very important for the channel. Also, if you know someone who might like these videos, share it with them and help us grow.